Hello and welcome to the Wellness Wave, a podcast series on health and well-being organized by the Media Department of the Heritage Academy. Today we have on board Dr. Jemsy Jose, Paediatrician associated with the AMRI Hospital, Mukundapur. Welcome, ma'am.
Thank you so much.
So, ma'am, to begin with, uh, the heat outside, the temperature, the weather is really bad, and we are always feeling tired and we are dehydrated all the time. We are sleepy because of that. So how can we deal with the extreme weather conditions?
Basically, as we know that when there is extreme heat and humidity, you lose a lot of salts and water through perspiration and sweating. So the main thing that we need to remember is that we keep hydrating ourselves from time to time, and there's nothing like water. So drink lots and lots of water throughout the day, and for an adult or for an adolescent also, you need about 2 to 3 liters of liquids per day. Younger children will require a little less, but we should focus on making sure that we drink lots of fluids, not only just water. You can drink tender coconut water, dab water, you can have lemonade with salt and water, you can have buttermilk, you can have fresh fruit juices. But students generally tend to have fizzy drinks because that initially quenches your thirst, but fizzy drinks, caffeinated drinks, alcoholic beverages, all these hydrate initially, but then they actually lead to long-term dehydration. So I would suggest that people drink more fresh fruit juices, buttermilk, tender coconut water, and lemonade. ORS is only when you have when you're sick with diarrhea or vomiting, then you can add ORS to your diet. The others are natural ORSs, like dab water, I say, is always very, very good because it's like a natural ORS. Never make the mistake of adding noon chini to water and having it, because there is no proportion, and this is very common among
that is very
parents.
common.
Noon chini jal khaiye dilam, but that's not right because there is no proportion that you're following. So you rather have a lemonade, mane lebur jal with noon chini, because then at least you know the taste is correct. Even with kids we say that don't give just salt and sugar water from made at home. You get small sachets for kids which you dissolve in 200 ml water, and for adults you have a proper like electrol and other ORS solutions which you add in 1 liter of water.
Okay.
And you give it throughout the day.
So water is the only
But
way to
water is the
survive.
best thing.
Better way to say so. So nowadays, eating disorder is a very common problem, and adolescents face that a lot. And
Yes.
parents are always worried about what we are eating and how we are eating. We are not eating much.
So the adolescents actually face this problem because they are now focusing on what what they should look like, what
Right.
their weight should be,
Body
and then there's a lot
goals.
of peer pressure. There's a lot of social media ideals, so to
Right.
speak, that this should be the right figure and right weight that you should have. So these lead to dangerous eating habits, and dangerous eating habits mean there are certain disorders which are definitely medical disorders like anorexia and bulimia and binge eating and all, but the adolescents are actually focusing on restricting the calories, restricting the time that they're eating, and these in turn lead to serious nutritional defects which they don't realize, and that in turn leads to them having digestive problems, disorders of the teeth and bones and skin, hair fall. All these things are linked, and ultimately immunity is destroyed because you're not eating healthy, nutritious food. So if we can make adolescents aware that you can eat good stuff, healthy home food, fresh fruits, vegetables, and still stay within your ideal body weight, that will be the best solution.
way to go.
Because these eating disorders which I mentioned, anorexia, bulimia, they are all linked to mental health disorders. You can have depression, you can have anxiety, you can have suicidal behavior with those kind of mental health disorders associated with the eating disorders, and they actually can kill a child or a young adult at times. So it is dangerous. So the earlier we can guide them, counsel them into thinking in a different way, their habits can be changed to healthier habits, and you can reverse the damage that the body has gone through from this binge eating, binge alcohol drinking, and then after that going and purging whatever you've had
Not
because you're
having
worried.
control of
Yeah.
what you
So
eat.
basically that is what it is. Not having control of what you're eating and how long you're eating.
Right. or not eating.
Or not
People
eating,
don't
yeah.
eat at all because
Yeah.
they are very not eating.
I just
skipping
had a
meals.
patient who came into my clinic who is 16 and a half, 17 years old, and she's only 30 kilos, and I had to give her an injection and she fainted straight after that because she's so thin. I had to counsel her that, look, you have to eat to feel healthy, to be healthy. And her skin was dry, her hair was coarse. So all of it is related to what you eat. You can have as many vitamins as you want, but there's nothing like natural food, right?
Right. Like you started talking about hair and skin. Skin issues is also a very young adults are always worried about how their skin is looking, or there are issues. They get a lot of acne breakouts and a lot of breakouts.
Correct.
So how can they keep that in control?
So again, the bottom line is healthy food habits. If you eat good amounts of fruits and vegetables and a decent quantity of carbohydrate and protein and fat, your body is going to get everything that it needs to restore your hair, your skin from the natural food. Okay, but if you kill your body by having severe dietary restrictions or eating the wrong kind of food, then naturally you will have skin issues. Now, skin issues like acne can be related to your body type as well. You can have an oily skin, you can have dandruff in your hair, but for that you need to have care taken. During the summer months, you can have acne breakout because if you put on a lot of makeup on your face and you clog your sweat pores and your oil glands, then you will break out into acne, which can get worse. If you don't drink water, your skin is going to get dehydrated. That can cause issues. Normally, I tell my young adults that you should wash your face with a good face wash, which removes all the oiliness. In between, also keep washing face with just normal water. It restores some amount of hydration from outside, as well as drink lots of water so that you're hydrating from inside. And it's the same thing with your hair. You need to take good care of your scalp. If it's an oily scalp, you need to use the right kind of shampoo to make it less oily. Make sure your hair is squeaky clean. There are a lot of children who come with a head full of oil, and if oil stays on the head, you are bound to get dandruff and itchy scalp.
Hair
and
fall is also
lice.
very
Yeah,
common
everything.
problem.
In summer, you have a lot of head lice in school children because of poor hygiene in hair hygiene. Because a lot of parents think that mathay tel lagi ele kintu thanda thakbe, which is a very, very wrong concept. It's the reverse actually. So you put oil. I tell my mothers, you put oil, but keep it for an hour and then shampoo it off. Your hair should be squeaky clean. Tale, as you grow older, this oily scalp will not turn into acne on your forehead.
Okay. Even that causes a lot of eye problems also. Hair.
Dandruff
causes a lot
you
of
can
eye
you can
problems.
have dry skin around your eyes
Right,
as well.
right.
But in summer itself, the sun's rays are quite strong, so you have very harsh UV rays. So you need to protect your eyes anyway during the summer. So we wear hats, or you wear sunglasses, which give you UV protection. And like I said, keep washing your face from time to time to prevent your eyes from getting dry.
Right. Also, because of the extreme heat or the weather conditions, eating everything we can't digest.
Fatty
So-
food and spicy food, all these things take longer to digest, and they also generate a lot of heat. So if you can eat fresh fruits and vegetables, there's nothing like it. We have so much of fruits available at this time, which is watery. Like you have standard watermelon juice, or eaten watermelon fresh. You have things like shakalu, you have things like jambrul. These are all natural fruits available during this season, which you can have. Bale, they're all good things which help your body maintain the hydration, as well as give you vitamins, of course.
Also light and not spicy.
And it's light and not spicy. Vegetables should also be included in your diet because they are easier to digest. But if you have a very heavy meal which is oily, like a meaty dish which is a lot of oil, which is not good, which is going to cause more issues for you.
Right. A fellow student has a brother who started talking very late. So the parents are concerned that why is he not talking? He's still 3, then he's not talking yet. So what can be the reasons behind that?
So a child who is about 2 years of age should be speaking a few words mama, baba, pakhi, this, certain small words. They might not be able to phrase 2-word sentences, but they should be able to have a good few words in their vocabulary. So any child who comes to me at about 2 years of age not speaking any words at all, the first thing I would ask the mother and the father to do is get a hearing assessment done. So we need to make sure the child has proper hearing. If we find that the hearing is okay and the child is still not able to speak anything by 2.5, then we definitely start speech therapy. Now, before that, before I come to just, it's not a simple speech delay. It could be a simple speech delay when there is a family history of speech delay and the child has everything else is okay, but his hearing is also okay, but he's not able to talk. That's different. There are other children who have certain other features associated with the speech delay, whereas an 18-month-old child comes to my clinic, and if I call the child's name, the child doesn't look at me. The child is sitting on the toy and playing on her own, does not have any eye contact, does not respond to her name being called, her or his or her name being called out, and the mother says, হ্যাঁ ও কিন্তু নিজে নিজেই খেলে, কারোর সঙ্গে খেলতে চায় না, sometimes makes noises, or sometimes gets irritated if there is certain particular noise that happens, like a pressure cooker's whistle blowing, or if there's a sound which comes from outside, bhoy pe jai, excessive crying kore. These are all subtle signs of a spectrum of disorders, which is autistic spectrum disorder. Shekhane, we need to make sure that the child is assessed. If the pediatrician raises the doubt, then we refer the child to a clinical psychologist who can then actually sit with the parent and do a proper assessment of the child's developmental ability, cognitive and speech and everything together. And then they can come to a diagnosis whether this child has autistic spectrum disorder or the child has only an isolated speech delay. So if it's just a speech delay, it'll improve tremendously with speech therapy. But if it's an autistic spectrum child, then we need to give other therapies as well. I advise my mothers with children who are having speech delay, I tell them, put them into play school so that they can interact with other children of their age group, and they will learn to follow commands. They will pick up more language. One big thing we tell parents is not to give them the phone, because all the kids now have the mobile phone in their hands. The parents are working from home, they are in front of their laptop, so to keep the child quiet, they give them the phone, and they are very proud that the child is doing a lot of learning from there. They amar bachcha kintu eta korte pare ota korte pare, but they don't realize that screen time is an absolute no before the age of 2. After that, you can show them big screen, but mobile phone, as much as possible, we tell them to avoid. So it gives them, the child also goes into that world of playing in the mobile, so that's how they get disconnected from the reality, from their surroundings. So in autistic spectrum children, we need to give them speech therapy along with behavioral therapy, occupational therapy, and all this helps them develop all round. So it's not just a simple speech therapy. Putting them into a school where they will get that added special needs support for education also. A lot of the parents don't want the children to go to schools where they are not mainstream. So they want their child to be completely mainstream all the time. But it might not be possible because that child will struggle in a mainstream school.
Right. So
Heritage is one of the schools which gives special needs, like a couple of other schools, but still it is very difficult for a special needs child to be adjusting to a big class where there are students who are all they are called neurodiverse, and neurotypical children are different, so they need special help.
Right. Okay. So ma'am, to end today's session, what final piece of advice would you like to give the college going students, the school students, to battle the heat?
Firstly, hydrate yourself. Keep having lots of liquids, whatever, like I said, Dab water and buttermilk and all that. Water, of course. Keep hydrating yourself throughout the day. Secondly, avoid venturing out in the peak sun hours in the scorching heat. So early afternoon to the sun setting, like from 11 o'clock till about 3-4 o'clock, don't go out and play in that heat, because you get a lot of heat stroke, heat exhaustion due to being exposed to that extreme heat. Thirdly, wear loose fitting clothes which are natural fibers like cotton clothes, underwear, as well as clothes on top, so that they are able to breathe. The body is able to have wind pass through. And wear a hat or hold an umbrella if you're going out, have glasses if you have, because a lot of children get headaches, they get dehydrated, and then they end up having fever, and that leads to heat exhaustion and heat stroke in the severe cases. You get a lot of illnesses like diarrhea, etc. too. So you need to maintain your hand hygiene as well. Keep washing your hands. Make sure the food that you're eating is fresh, not kept out, because during the heat, because of the heat, the food can get stale and go off quite quickly. So make sure the food is stored properly, and you give them tiffin which is not going to get spoiled.
Okay. So with that, we come to an end of today's session. Thank you everyone for tuning in. Thank you so much, ma'am, for your precious time.
Thank you so much
It
for
was
having me
lovely
here.
talking to you.
Thank you so much for having me.